Hi, my name is Dr. Justin Davis, and today I'd like to talk to you about a disorder called ADD, Attention Deficit Disorder. Now, more commonly today, we refer to this as ADHD, Attention Deficit Hyperactivity Disorder, because we feel that this more accurately describes the condition. Now, this is a problem that affects millions of American children and can persist into adulthood. Now, what exactly is ADHD or ADD? Well, this is a problem, as the term describes, where people have problems with attention as well as hyperactivity. These are the main categories that determine if someone has ADD or ADHD. Now, something that's very important, because so many children these days are diagnosed with this problem, is that this is not simply a problem where a child is a little bit deficient in their attention or hyperactive, because so many children really are. But it has to be a problem that persists into different areas of their life, home life, with their friends, at school, and causes significant problems in their life. So if it's not causing significant problems, then it's not a disease state, it's just naturally a rambunctious child. Something else that's very important in the diagnosis in determining whether a child or an adult has ADHD, it has to have both characteristics of attention deficit and hyperactivity, and in fact, 6 different symptoms from each of those 2 categories. So what do we do with children or adults that have ADHD? Well, again, this is very common, and if it doesn't cause any problems, then perhaps not too much needs to be done. But sometimes it does cause serious problems, and then what do we do about it? Well, first of all, before we jump into medications, consider therapy. Sometimes therapy with the individual child or with entire families and parents can be a very important part of learning to deal with the problems associated with ADD and learning to treat it correctly. Sometimes when that's not enough, we use different kinds of medications to help out a little bit. Now, there are serious problems that can be associated with the medications, so it's always important to consult with a healthcare professional, sometimes with multiple ones, before you decide on treating with medication and which one might be right for your child or you as an adult. Usually today, the medications that we use for treating ADD are stimulants. Now, this may not make sense, and it doesn't exactly scientifically make sense to us either, but it seems to work pretty well in helping to control the problem. What can you do to prevent having ADD? Well, perhaps there's nothing that we can truly do except for to recognize it early. However, there are certain people and certain studies that may point towards certain things like having a healthy diet for your child, having a healthy exercise regimen, and having good prenatal care and vitamins. These are things that perhaps may help to prevent a child from having ADD. It's also important to have teachers that know how to deal with children and determine whether they're really a rambunctious child or they actually have a problem such as ADD. So remember, if you think that your child is overly rambunctious or just can't pay attention, well, before jumping to any conclusions, consult with a healthcare professional, especially someone that specializes in childhood disorders like ADD, and get an accurate diagnosis so that you can have professional and good treatment.